Okay, can everyone see and hear me and see the screen in front of them?
Yes.
Brilliant. Okay, well, thank you very much to everyone for joining this meeting. So, this is a webinar that is going to be about talking to you about the new MA in Global Medical and Health Humanities at Lancaster University. So, hopefully, I'm going to give you a kind of short overview of the MA and then kind of get into a bit of a taster about the kind of things that you might be exploring during the MA. So my name is Benjamin Dalton, and I'm a lecturer in French Studies in the School of Global Affairs, and I'm also program lead for the MA in Global Medical and Health Humanities. And all of my research kind of exists within the medical and health humanities. So I look at kind of philosophical, cultural approaches to health, medicine, and illness in contemporary cultures. So, what is the MA in Global Medical and Health Humanities? I would say that the program kind of starts with the idea that biomedical science alone cannot solve the healthcare challenges of our times. So, whatever the challenge, I would say we need to understand the social, political, and cultural dimensions of healthcare and medicine as well. So, the medical and health humanities are a growing interdisciplinary field. So, they bring together many different disciplines to approach and tackle diverse questions and problems relating to medicine and healthcare. So, they ask, how can the arts, humanities, and social sciences help us to face some of the biggest challenges facing healthcare? And how can the arts, humanities, and social sciences help us to imagine the futures of healthcare as well? And how can we further understand the social, political, and cultural dimensions of healthcare, medicine, illness, and well-being? So I just wanted to give you a few examples of the kinds of challenges that we're facing currently in the world. So I think one of the most obvious challenges that we've all just lived together and experienced together is the COVID-19 pandemic, which has recently shook the world and continues to reverberate around the world. So the COVID-19 pandemic was not just a challenge of developing vaccines and coming to terms with the nature, the biomedical nature of the virus that we were encountering. It was also a case of understanding the political aspect of how different countries work together during the crisis. It was also about understanding the differences, the cultural differences between how different countries, societies, and communities dealt with things such as lockdown. So different cultures dealt with this in different ways, and different cultures were kind of readier than others, perhaps, to engage with some of those lockdown measures. The COVID-19 pandemic also saw an explosion of art and culture. So we had people writing about their experiences, we had people making music about their experiences, creating blogs, artwork. It was a complete kind of cultural boom in that place as well. And so it's really important that we use methods in the medical and health humanities to examine the cultural outputs from the COVID-19 pandemic, which can show us what it felt like to be a human during this time, what it felt like to encounter lockdown and to be kind of alone in our houses. We know that the COVID-19 pandemic kind of brought with it a range of challenges for mental health or people that suddenly found themselves severed from their families, friends, and communities. So it's really important that we understand the cultural and personal aspects of what that felt like as well, to kind of think about how we would be more prepared for this in the future and the impact that it has on us as humans. I should also say that the COVID-19 pandemic also kind of coexisted alongside many different political and activist movements of the time. So we also had the Black Lives Matter movement during the COVID-19 pandemic. So there's also a need to understand how political and activist movements occur alongside and in relation to some of these healthcare challenges and crises. So I've put here a couple of examples of how the arts, humanities, and social sciences can help us to understand pandemics better. And in my classes, I teach the novel In the Company of Men by Véronique Tadjot, who writes about the Ebola pandemic in West Africa. And she writes a really exciting and interesting novel here in that she approaches the pandemic not just from one singular human perspective, but from the perspectives of non-human animals, even trees, even the kind of viewpoint of the virus itself. And she kind of makes the argument that we are experiencing pandemics only through the lens of being human, whereas in fact, they kind of comprise a much broader environmental, ecological kind of zone or area than that. So the COVID-19 pandemic also brought to the focus our hospitals and the actual physical environments in which healthcare uh, is carried out. So we were seeing images of hospitals all the time in the news, etc. And they really kind of shone a light on what are our current healthcare environments, what are the problems with them. Here in the UK context, it shone a light on the National Health Service, the NHS, and kind of shone a light on those issues of kind of whether our hospitals continue to be fit for purpose and what the hospitals of the future might look like. So it was also a time in which different cultures were experiencing the hospitals and healthcare provision in other countries, other cultures, other communities, and became a time to learn from each other about all of those aspects. So there's lots of really exciting research currently ongoing in the medical and health humanities regarding the hospital. So we have works like The Covert Life of Hospital Architecture, which explores the hospital from many different points of view, including cultural, social, and political viewpoints. And then also books like The Architecture of Health, Hospital Design, and the Construction of Dignity, which shows how architectural design developed and evolved throughout history and how each kind of healthcare design is related to a particular social or political moment, and that it's crucial to understand these moments in order to design the healthcare environments of the future. We also know that currently in the world there is a lot of healthcare inequality. So, depending on your gender, sexuality, race, ethnicity, beliefs, disability, etc., people don't all have the same access to health and care. And this is definitely one of the huge challenges that we need to move beyond in today's world. And the medical and health humanities can help us to do that as well. So, I've got two very brief examples here. So the film on the left there, 120 BPM, this is a French film about responses to the HIV/AIDS crisis in France in the 80s and 90s, and really shows healthcare inequalities with regards to LGBTQIA plus people. On the right here, we have the philosopher and psychiatrist or psychoanalyst Frantz Fanon, who writes in his work Black Skin, White Masks about exactly how racial biases exist in society and how they impact on things like health and care. So those already we can see a filmic and a philosophical approach to thinking about healthcare inequalities. So, how can the arts, humanities, and social sciences collaborate with medicine to face these challenges? So, I've mentioned a few already, but we can think about how explorations of illness, disability, and care across literature, film, and art can help us to explore and demonstrate the human experience of health and care. It's also very important for us to understand histories of medicine and illness, as this shows how different cultures have understood health and care throughout time. And it shows us, in fact, that there's not one way of approaching healthcare or understanding illness, but many different cultural voices that we need to listen to. So political theory can also help us understand healthcare inequalities. So the question of why do some people and communities have better access to healthcare than others? In thinking forward to the future, we can also think about how methodologies such as speculative design and design fiction, which I'll talk about a little more in a moment, can help us to imagine the healthcare environments of the future. So you can see that across the arts, humanities, and social sciences, these different methodologies allow us to explore the past and the history of healthcare, medicine, and illness, but also to design the futures of healthcare and understandings of illness, all through kind of bringing these human experiences to the fore. So, how does the MA in Global Medical and Health Humanities allow us to encounter these problems? So, I won't kind of go into detail in how the course is structured. You can find that online. But to give you a kind of brief overview, you'll be taking some core modules. The first of which is navigating global medical and health humanities. And this core module gives you a diverse range of methodologies and contexts to begin with. And you'll learn all about the kind of theories, histories, philosophies of medicine and healthcare, and come across a lot of different approaches. So that really kind of gives you a resource or a kind of wealth of resources to begin with. One of the most exciting points of the MA are these two studio modules that you can see on the screen here. So Applied Learning Studio 1 and Applied Learning Studio 2. These are the spaces in which you will activate some of these theoretical and methodological approaches that you've been learning about. So here you'll be working in teams on live briefs. So you'll be kind of confronted with a particular challenge, and you'll use all of those theories and methodologies in a team to create a project that has the power to bring about change and real life impact in relation to that challenge. So I'm going to give you an example of what you might have as a studio module live brief. So here's an example. A new hospital is going to be built in Lancaster on the Bailrig East site. Your task is to design a project that will promote inclusivity in the hospital, ensuring that the new hospital is designed to be welcoming to all patients, regardless of their age, their gender identity, their sexuality, race, ethnicity, disability, or beliefs. So this is a live brief that is grounded within reality, and really excitingly, in Lancaster, we have a proposed site for a brand new hospital, the brand new replacement hospital for the existing Royal Lancaster Infirmary. And you can see it there in blue. So right at the bottom of the screen, in the middle, you'll see a sign that says Welcome Centre. So that's the middle of our university campus. And just to the right with the blue square, this is the proposed site for the replacement hospital. So currently, this is just a kind of site of fields. There's nothing there currently. So it is nothing but possibility. So there's all of these possibilities for us to come together across disciplines, across medicine, across healthcare, across the arts, humanities, and social sciences to think about what kind of hospital we could develop there. The hospital is being developed as part of the New Hospitals programme in the UK, and in particular the Lancashire and South Cumbria New Hospitals programme. And this programme is bringing together people from all different disciplines to think about how to build these hospitals. So this is the kind of thing that you can imagine yourself creating a project inspired by on the MA. So I'm going to talk to you about some of the research currently ongoing at Lancaster that might give you some ideas or inspiration for how the arts, humanities, and social sciences can contribute to designing inclusive hospitals for the future. So this is a particular project, designing the waiting room of the future through design fiction, in which I worked with colleagues, Dr. Naomi Jacobs in Leica, who's in design, and Dr. Dio Eseonu, who is in PPR, so Politics, Philosophy, and Religion at Lancaster. And Naomi Jacobs works on a methodology called design fiction. And design fiction means designing artifacts that might be from the future to give people a sense of what the future might feel like, or what the experience of the future might be like. And this gives people the opportunity to think about how we can design better alternative futures. So, as an example, we decided that we wanted to design the waiting room of the future. Currently, waiting rooms in hospitals in the UK have been criticised for their lack of inclusivity. So sometimes they're not very accessible to patients with disabilities. Sometimes they might implicitly kind of have posters on the walls that show mainly white patients or mainly heteronormative patients, etc. So kind of playing into different kinds of biases. So what we did is we designed the waiting room of the future, imagining what it would look like in 100 years' time. And we tried to do everything from reimagining what posters would be in the on the walls, reimagining what the lighting would be like, reimagining how we could have different spaces of the waiting room for different people with various preferences for lighting or sound, etc. So we had a quiet corner, for example, that had headphones with different types of music for people to listen to, and different types of toys also for children to play with. And then what we did is we invited current healthcare professionals to engage with the space. So we kind of did a simulation of the space in which doctors, nurses, and kind of other people involved in healthcare sat in the space. They pretended that they were patients, etc. And then they came up with critiques of that space. And we came together at the end and designed together an alternative waiting room based on those critiques. So that's one methodology that you could explore. Another fantastic project at Lancaster for thinking about inclusivity within healthcare is by Professor Elena Semino, who's in linguistics at Lancaster, and her creation of a metaphor menu, or what she calls a metaphor menu for people living with cancer. So, Elena Semino's work looked linguistically at how patients describe their experiences of living with cancer. And she noticed that people have very different metaphors that they use. However, often we find the metaphors used within the media to be quite narrowing or quite limited. So we often talk about cancer in military terms as a fight, or something we need to defend against, or something, a fight that people might be losing, etc. And those metaphors are not productive for everyone. So what Elena Semino wanted to do was give a kind of a metaphor menu, so with many different diverse metaphors, so that patients could decide which metaphors were most helpful to them in communicating their experience and in communicating their illness to healthcare professionals. So here you have metaphors that range from thinking of the body as a musical score, where particular cancer cells are maybe not in harmony with the rest of the score, and you're wanting to bring them into melodious harmony with it. There's other metaphors about growing a garden. There's other metaphors about going on a journey, etc. So that promotes inclusivity through giving patients wider and more diverse kind of fields of language or metaphors to choose from and find the ones that most speak to them. Another project that is currently ongoing at Lancaster is relating to LGBTQIA plus inclusivity within the hospital. So we know that often queer people or members of the LGBTQIA plus community do not feel welcome within the hospital for particular reasons. So they might find that some services are kind of biased towards kind of a binary idea of gender identity, or they might find that kind of wards being arranged into a ward for men and a ward for women might not be particularly inclusive, and a whole other range of different reasons. So we want to explore how we can make hospitals more inclusive to LGBTQIA plus patients. And to begin doing that work, we are creating an archive of patient experiences of healthcare environments. And this will include us designing an app so that queer and LGBTQIA plus patients can archive or record how they experience hospital spaces in a variety of different ways. So they could write about it, they can produce music about it, they can upload artwork to this archive. And then once we've created this archive, we're going to look through it and see which themes emerge, particularly which themes of the kind of cultural, social, political experiences of the hospital emerge. And then we're going to try and think about the next stage of the project, which will be designing kind of spaces for the future that might be more inclusive. So at this point, I'm going to hand over to my colleague, Professor Carlos Lopez, who is a program lead on the MA in Sustainability and Global Environmental Futures. So as I said at the beginning of this talk, on the MA, you'll be engaging in studio modules, and those studio modules will include students who are on other MAs. So the MA in Sustainability and Global Environmental Futures is one of those. And on the second studio module, you might find yourselves working with students on that MA to explore these global challenges from interdisciplinary perspectives across healthcare and environment, etc. So I'll hand over to you, Carlos.
Yes, thank you, Ben. Can you hear me okay? There seems to be something happening with the camera because it just gets on and off. But if you leave the slide, what matters is what I'm going to say. So if you're happy to just skip this slide for the time being, then I'll speak to it. Will that be okay?
Yeah, we could see you, Arya, but...
Okay. Well, it doesn't really matter. But thank you very much, Ben. That was terrific. And I think, as Ben just said, one of the things that we've been planning as part of this suite of new 4MA programs is to try and think about the integrated way of understanding different kinds of questions. And in connection to sustainability and global environmental futures, there's a whole range of connections to questions around health, around medical humanities. I was very pleased to hear Ben making a number of different references to archives and the role of history in understanding the ways in which some of the challenges that we experience today have actually nothing, there's often nothing new about some of those challenges. So in connection to what we want to address with sustainability and global environmental futures, I'm just selecting a few things. One is the urgency and acceleration of the rate of change. And there's some by now established understandings of, for example, the change which is anthropogenic, in other words, is human agency causing change at rates which tend to be 170 times faster than they would otherwise be. So the picture on the left, I hope you can all see it. That's a prediction of what may happen to the bay where we are in Lancaster. So this is the Morecambe Bay by 2050. And so what that means, the area on red suggests that that precise coastline could be underwater. And this is a prediction. That's all it is. It's no more and nothing less than that. What is interesting, obviously, is that it's a prediction into the future in 2050. If we predict to 2100, for example, again, it will be different. And so understanding the political inaction in some cases, the cultural indifference in others, is to try and think differently about the different timescales that, for example, climate prediction models would use in order to determine paths to action in the present. And obviously, all of them would be connected to the contexts, the places and the times and the development of those areas, which in the case of the Morecambe Bay alone differs very significantly between, say, Barrow in Furness compared to Fleetwood or Arnside in Silverdale or Lancaster. And so one of the things that we want to do with the MA in Sustainability and Global Environmental Futures is to think about interlocking timescales. In other words, trying to see that geological timescales, so millions of years, are important to understand what we may or may not do in connection to responses in the present. But similarly, thinking about generations, so how to become good ancestors, so that the generations of the future can actually recognize our lack of action, or on the contrary, instigating positive change through reflection, through engaging with different communities, interest groups, governments, and so on. in connection to being inclusive about what changes do we want to create and leave for future generations. And I think one of the closest connections to Ben's program, the program on global medical humanities, is the question around difference. And difference to do with, for example, times of the more than human, times of nature, times of the change of an Earth system that again goes into millions and billions of years. And the reason why that is important is not so much to make us feel insignificant, but to develop a time of temporal literacy so that we are better positioned to face the significant challenges that a climate emergency is posing on us from the early 21st century throughout the end of this century, indeed. So that's what I wanted to say, Ben. And I don't know if we have time for questions or.
Yes, absolutely. So just to say to everyone that you can visit the course pages here. So I think there are some QR codes as well for taster sessions in the future. So there's one on the 7th of March, one on the 12th of March, and one on the 21st of March, depending on which of the MAs you're most interested in. And you can get in touch with any of us as program leads at any point. So if you want to get in touch with me, for example, about the MA in Global Medical and Health Humanities, please feel free to email me directly at b.dalton@lancaster.ac.uk. I'll be more than happy to answer any questions.